My name's Theo Van Liesout. I'm a sexual health physician and I work at the Brisbane Sexual Health Service.
My name's Tracy Schrader. I'm a doctor and I've worked at the sexual health clinic, the Brisbane Sexual Health Clinic, for over 17 years. And I've worked alongside very well-trained, very professional nurses during this time.
It provides specialist services for HIV, syphilis, gonorrhea, to particular groups of people, and it's one clinic in a whole group of clinics around Australia that are out to stamp out sexually transmitted infections before they become more prevalent.
The clinic has actually been going in some form or another since the 1940s. We see people who don't have the money or the ability to access general practice. They may not have a general practitioner. There may be certain reasons that they don't want to be known and remain anonymous. We have people visiting. It's not just Metro North we help with. It's all over Queensland, interstate and overseas.
My name's Kyle Chapman. I'm 19 and I study a Bachelor of Arts at UQ. I have a lot of friends and I know a lot of people that go to the clinic, and it's really accessible and a lot of people know about it and have been there and have had a lot of good care from there, and it's just very important, and I don't think it should be cut because there aren't a lot of places like that around.
The Brisbane Sexual Health Service is the biggest sexual health service in Queensland, and by closing this service it will form a breach in the defences in Australia. Because we've got about 800 HIV positive patients, and because we see about 12,000 patients a year for sexually transmitted diseases, the staff that were left couldn't run that service.
We see people who've been overseas and don't want their usual general practitioner to know what has happened. We see school children who come in after school. We see sex industry workers who come in for their certificates. One told me she asked her GP and she said, "Oh no, we don't do that." Where do they go now?
At least 40% of gay people in Brisbane actually go to this service, so if they're cutting it, then they're going to have to go other places and where they don't know anyone and they aren't comfortable with the people and they haven't actually been there before.
The service that remains is a service that was focused only on HIV, but the problem is you can't uncouple the delivery of HIV from sexual health services. Sexually transmitted diseases help HIV infect someone, so and it's about 2 to 5 times greater risk if you have another sexually transmitted disease. There is a public health risk if patients fail to access care and treatment because of resistance to accessing services that may not provide anonymity, confidentiality, open access, no charge, specialist services, acceptance of socially marginalised populations. The rates of HIV and STIs increase due to clients not accessing appropriate HIV and sexual health service testing and treatment. There is no clear mitigation strategy relating to this risk, full stop.
These things just don't stay in one little spot. They spread throughout the community. Even the backpackers that visit, I mean, they're not going to just stay amongst themselves. You know, it could be these politicians' children.
Nowadays it's a lot more open, you know, a lot more people are having sex and they're a lot more sexually active. It's really important for people to be educated on sexual transmitted diseases and how to know how to combat it if it happens and how to get treated.
It is penny wise and pound foolish. Because the costs to the community are going to be huge.
There will be a rise in sexually transmitted infections and probably HIV as well, because the two are very much interlinked.
Personally, no, I don't think the government's taking the right approach because they're limiting people to the amount of places they have to go to get treated and to get scanned or to just get help.
It just takes the minister to pull the chairman of the board at Metro North into line with the rest of Australia. We want the service to stay because it's too valuable to go.